Hi, my name's Cory Grandinetti, and I'm an occupational therapist. I'm currently working in the Shoreline School District here in Shoreline, Washington. And previously, I worked for Rehab Without Walls and served as Director of Clinical Management at Rehab Without Walls. And prior to that, I worked at Harborview Medical Center in the inpatient rehab unit for a number of years, working with people with neurological injuries. Bowel and bladder and sexual health became my interest because they have such an impact on quality of life. Anybody that has sex knows that if you have to go to the bathroom, it can impact sexual activity. That doesn't change even if you can't feel whether or not you have to go to the bathroom. So if someone has a spinal cord injury and needs to manage, your bladder with another means, whether it's intermittent cathing or an indwelling catheter, you have to make plans for how you're going to manage your bladder in preparation to have sex. Planning for sex if you need to. So if someone has an indwelling catheter and they know they want to plan to have sex at some time that day, you can plan ahead to think, okay, I need to empty my leg bag before then. But if you don't want to have that indwelling catheter in during sex, you got to plan for how that's coming out. So if a caregiver needs to do that, talking to your caregiver in anticipation of that, to wait until right before sex to take that out, and then make sure you kind of put it back in after sex. But the other additional consideration that I think is very important for people with spinal cord injury is if you're managing your bladder with intermittent catheterization or any kind of indwelling catheter, and you're using lubrication during sex, which needs to happen, you need to be really attentive to a couple of things. One is using lubrication. So you need to use lubrication when having sex, especially if you're using sex toys. But also then when you're done having sex, making sure you thoroughly clean and dry that area and not leave it moist. Because warm, moist areas are where bacteria grows. And so if you're using a means like an indwelling catheter or intermittent catheterization, you're just inviting more germs to come in. The other consideration is you might have an accident. And so a couple of things, I shouldn't say that. So some people are really into having urination during sex. It's kind of a thing. It's a kink. And maybe that'll be awesome for you. And if it's not, I think there are a couple of things to consider. I think bladder management after an injury can be kind of devastating if an adult feels like they are now having accidents after years of not having accidents, and that can also cause someone to be really fearful to have sex because they're worried about having an accident during sex. So there are a couple things that I would recommend, and that is if you are kind of prone to having accidents, that usually happens when your bladder is full or semi-full. So maybe planning ahead and emptying your bladder before you have sex. The other idea is they even make really satiny kind of sheets that are waterproof. There are ways to not just use a medical chuck pad, but you can also use that. And communicate with your partner that this may happen during sex, and plan ahead so that it doesn't have to limit your fun and it doesn't have to kind of wreck the mood. And if it's a kind of a constant problem or a problem that you can pretty consistently plan for, you can also choose to have sex in the shower, on a shower chair, so that you can easily clean it up, and make it kind of more normalized for yourself and for your partner or partners, and know that having a sense of humor can help. And I think communicating prior to your sexual activity about the possibility can also just kind of take the concern off the table.